Hello everyone, this is your surgery coding guru, and before we begin, please subscribe the channel. So today we will learn about the skin cyst and the lipoma. What is the difference between a skin cyst and a lipoma? How do we code the CPT and ICD of a skin cyst and a lipoma? Skin cyst can be a sebaceous cyst or an epidermoid cyst, epidermoid inclusion cyst. We can also call it like that. And we will be seeing the difference. So let's begin. So this is sebaceous cyst versus lipoma. If you see, this is a cyst which is present in the epidermal area, and it can go deeper also. Later I will show you. And this is a lipoma. Lipoma is generally a fatty tissue. And let's see the next slide. So here is the description of both kind of masses. A cyst is a sac under the skin filled with either fluid or pus or air or other substances. If you see, this is the epidermal inclusion cyst, and if you can make out there is some pus inside it. So this is epidermal inclusion cyst. And a lipoma is a lump of fatty tissue under the skin. And under the skin means it can be in subcutaneous area, it can be in subfacial area, it can be in submuscular area. So a lipoma is a lump of fatty tissue under the skin, and it is not cancer. Both the cases are actually benign cases. Okay, so we have CPT for skin cysts also, which is in integumentary section, and we have CPT of lipoma, which is in musculoskeletal section. So from when the patient reaches the surgeon, so the surgeon always call it as mass or lesion. So he will call this also as mass and this also as mass. But later, after excision, when he will send it for pathology, then the real picture comes, because the pathologist tells whether it is a skin cyst, that is an epidermoid cyst, or a sebaceous cyst, or a lipoma, that is a fatty tissue. So that gets cleared after the pathology report. So initially, doctor always says it's a mass. Okay, and that is where when we see an op note, we always send the case. We always wait for the pathology report to come before we code it, because we need a definitive diagnosis to code the ICD and CPT, because the CPTs are diagnosis based. That is why diagnosis is very, very important. Okay, both are benign conditions, not malignant, basically not cancer. So here is a list of uh, places where lipoma can be found. So I have told you many times, so this is the epidermis, the skin which we see, we touch. Then comes the dermis. Then this is the subcutaneous part, the subfacial part. So the lipoma can be present in this subcutaneous area. So we have a CPT for subcutaneous lipoma. We have a CPT for subfacial and submuscular lipomas. That is why in the op note it should be very much specific that the lipoma is of subcutaneous origin, or subfacial or submuscular or intramuscular, or even deeper. So where the lipoma is, accordingly we code the CPT and even the ICD. So it can be in the subcutaneous area, it can be in the subfacial area, it can be in the submuscular area, intramuscular area, intermuscular area, basically inside the muscle. Okay, so now let's see, this is bone. If by chance the cyst is in the bone, so that will be a bone cyst and will be coded in a different manner. Okay, so lipoma can be seen from outside only, but the origin can be different. Even lipomas can start from the dermal area also, but then it goes deeper. Okay, so we code ICD as, if it is superficial, we code D17.1, which is of trunk. And if it is intramuscular, submuscular, subfacial, deep soft tissue, then we code D17.79, because in our ICD, subfacial or submuscular is not specified. So we go with D17.79, which says other sites, because we do not have direct ICD. So if they say subcutaneous, that is superficial one, then it is D17.1. Now, epidermal inclusion cyst or sebaceous cyst, though. So then the epidermal cyst is in the intraepidermal cyst, in the epidermal area only, very superficial. Then intradermal cyst in the dermal area. Then dermo-hypodermal junction cyst, basically where the dermis ends and subcutaneous or the hypodermis area starts. We call subcutaneous and hypodermis are the same. So the junction where the dermis ends and subcutaneous or the hypodermis layer starts, that is called as dermo-hypodermal junction. So the cyst can be there or in the subcutaneous or the hypodermal area. So that is hypodermal or subcutaneous cyst, or even deeper. It can go till fascia. But do not get confused that now it is facial, subfacial, so it will be a lipoma. No, there is a possibility that a cyst, origin of the cyst is a skin. It is a skin cyst, but it is going deeper. So that is why it is very important for us to wait for the pathology report, because that only will give the clear picture whether it is a skin cyst or a fatty tissue, that is lipoma. So that is why always wait for the pathology report. Let it come and then only code the ICD and the CPT. Okay? Now, if, for example, we take it like this. So we had this back epidermal cyst 2 centimeter, back lipoma 2 centimeters. So if we consider that there is an epidermal cyst and the size is 2 centimeter, so we will code the epidermis dermoid cyst as L72.0, and CPT will be coded from this range according to the size. And the back is always coded from trunk site. Okay. So, and if there is a layered closure or complex closure, so always report it separately. So code the excision CPT and the closure CPT. But if there is adjacent tissue transfer, also known as ATT, like VY-plasty, rotation flap, Z-plasty, W-plasty, advancement flap, random flap, so we code from this range. And when we code ATT, we do not code the excision code. We skip it because it bundles an ATT. If you want to know about the ATT, I had made a video on skin mass excision where I have shown that how ATT is done, how it is different from layered closure or complex closure. So you may go and check that out. Next, so this is our range. This is benign. I told you an epidermal cyst or a sebaceous cyst are benign lesions. That is why we will quote from benign section. This is the trunk area. Even for arms or legs, we quote from this particular range only. These are the sizes. So according to the size, like we had 2 centimeters, so we will be quoting 11402. So this is what it is written, what I have already told you, that intermediate closure and complex closure are reported separately. And of course, the excision CPT is also coded separately. But if by chance it is ATT, then we do not code the CPT of excision. We only code ATT in that. Okay? So lipoma back. Okay. So this is for lipoma back. So if the lipoma is subcutaneous, so we code D17.1. If it is subfacial or submuscular, then we code D17.79. So this is the CPT range for back lipoma. This is in the musculoskeletal chapter. Back and flank, excision, tumor, soft tissue. I told lipoma is a soft tissue lesion. So soft tissue of back or flank. Now they have separated the subcutaneous and subfacial differently. So separately. So if the lipoma is subcutaneous, depending upon the op node, we code from this range either 21930 or 21935 according to the size. If it is subfacial or intramuscular, we code from this range and according to the size. So it is very important to read the op note carefully and decide whether the lipoma is subcutaneous or subfacial, whether the size given or not given. So if not given, then we ask the physician for the size. Okay, so it is again the same trunk area from trunk area. If it is skin, subcutaneous tissue, lipoma. If subfacial, then D17.9, subcutaneous, then D17.1.